Consume garlic. However, refrain from committing these 6 errors, as they may prove fatal. Garlic has been the most potent natural medicine for centuries. However, what if I were to inform you that this miraculous bulb, which is currently in your kitchen, could become lethal with just 6 simple errors? There is shocking evidence that garlic, when consumed incorrectly, can activate catastrophic reactions in the body, which is concealed deep within ancient medical texts and suppressed by modern pharmaceutical interests. According to recent research, 99% of seniors are making fatal mistakes with garlic. These errors have the potential to increase liver stress by 47%, thin the blood to hazardous levels, or completely eliminate any benefit that was believed to be obtained. It is possible that you are ingesting it incorrectly, preparing it incorrectly, or combining it with medications that render it toxic. According to one study, the efficacy of a cardiac medication was diminished by 51% as a result of a single one of these errors. That is not a fable. It is simply science. And Big Pharma is not interested in disclosing this information to you, as garlic can serve as a substitute for numerous medications when used correctly. However, if employed incorrectly, it could result in your death. In this video, we will reveal 6 astonishing garlic errors that are rarely discussed, but which are essential for all seniors to be aware of. The second error is that it may gradually harm your brain without your awareness. Before we dive into these potentially life-saving insights, let me ask you 2 quick questions. Have you ever had an unexpected reaction after eating garlic? And what's your favorite way to prepare it? We're here, reading every comment, and offering personalized tips, so don't hold back. And if this topic matters to you, make sure to subscribe to Man After 70 for more honest, helpful content made just for you. Moving forward, we will commence with the least detrimental error and progress to the most life-threatening. The 6th error is the improper stowage condition. The least frequent but still hazardous error is the improper storage of garlic, particularly in oil. When you slice fresh garlic and immerse it in oil at room temperature, you are establishing an ideal environment for Clostridium botulinum, the bacterium that causes botulism. This anaerobic bacterium flourishes in oxygen-free environments, such as oil-covered garlic. 48 cases of foodborne botulism associated with domestic garlic in oil preparations were investigated in a study published in the Journal of Food Protection. The researchers discovered that toxin production increased by 400% when stored at ambient temperature for only 48 hours. The most alarming aspect is that botulinum toxin is tasteless and inert, which means that it will remain undetectable until symptoms manifest. The symptoms commence subtly with blurred vision and dry mouth. However, paralysis commences to extend from the face down through the body within 12 to 36 hours. Respiratory failure may establish itself in the absence of immediate medical intervention, as the contaminant disrupts nerve signals to muscles. Mechanical ventilation was necessary in 23% of the documented cases. The resolution is unexpectedly straightforward. Garlic-infused oil should be stored in a refrigerator and consumed within a week. Bacterial proliferation is significantly impeded by the cold temperature. Alternatively, it is preferable to prepare small quantities of food from scratch as required. Commercial preparations are secure due to the presence of preservatives or acids that inhibit bacterial proliferation. Citric acid or lemon juice may be incorporated into the domestic version to reduce the pH below 4.6, thereby establishing an environment in which botulinum cannot thrive. Instead, implement this approach to optimize safety and advantages. Roast whole garlic cloves in olive oil at 300 degrees Fahrenheit for 45 minutes, then strain and refrigerate immediately. The roasted garlic flavor is actually more complex and beneficial than raw preparations, and the heat eliminates any pathogens that may be present. The 5th error, incorporating garlic with diabetes medications. As we progress along our hazard scale, we encounter an error that has a global impact on millions of diabetics. Garlic contains compounds that naturally reduce blood sugar levels, which may appear advantageous until one considers the consequences of combining it with diabetes medications. The National Institute of Diabetes in India, conducted a study on 146 type 2 diabetics who consumed garlic supplements in addition to their prescribed medications. The research demonstrated that 31% of the participants experienced hypoglycemic episodes, which are defined as a decline in blood sugar below 50 mg per deciliter, a level that is considered dangerous. Emergency hospitalization was necessary for 9 participants. The active compound allicin in garlic increases insulin sensitivity and improves the assimilation of glucose by cells. The addition of substantial quantities of garlic to metformin or insulin results in a compounding effect. Confusion, seizures, or loss of consciousness may result from an abrupt decrease in blood sugar levels. Dr. Sarah Chen, an endocrinologist at Johns Hopkins, documented a case in which a patient who was taking metformin and consuming 4 cloves of raw garlic daily encountered severe hypoglycemia. His wife discovered him unresponsive after his blood sugar plummeted to 38 mg per deciliter during slumber. His life was only spared by an immediate glucose injection. The correction does not involve the complete avoidance of garlic. Rather, it involves the meticulous monitoring and timing of its use. Garlic should be consumed with meals, rather than on an empty stomach if you have diabetes. This delays the absorption process and mitigates the abrupt decrease in blood sugar levels. Begin with small quantities, such as 1 clove per day, and attentively monitor your glucose levels for a period of 2 weeks. It is of the utmost importance to notify your physician of your garlic consumption. It may be necessary for them to modify the dosage of your medication. Under medical supervision, numerous patients have effectively incorporated garlic by slightly reducing their medication. The critical factor is the consistent monitoring and gradual introduction. Cooked garlic is preferable to raw garlic as it preserves other beneficial compounds while reducing allicin content by approximately 40%. Mistake number 4 involves consuming fresh garlic on an empty stomach. This error has resulted in the admission of numerous individuals to emergency facilities with severe pain. If you have ulcers, gastritis, or inflammatory gastrointestinal conditions, consuming raw garlic on an empty stomach can be disastrous. In addition to its medicinal properties, garlic's sulfur compounds are also highly irritating to digestive tissues that have been damaged. 89 patients with confirmed stomach ulcers who ingested raw garlic were the subject of a gastroenterology study conducted at Sewell National University. Severe hemorrhage episodes were experienced by 42% of the group, and 18% of the group required blood transfusions. The mechanism's simplicity is brutal. Allicin and other sulfur compounds stimulate the production of stomach acid while concurrently irritating the protective mucus layer. Dr. Michael Torres, a gastroenterologist in Miami, recounts the experience of treating a patient who consumed 3 fresh garlic cloves each morning to enhance his immune system. She was unaware that she was developing ulcers. Subsequently, she experienced a stabbing sensation and vomited blood one morning. The garlic had caused a perforation that necessitated emergency surgery, as it had literally burnt through her ulcer. The inflammatory response is not restricted to the stomach. Individuals with ulcerative colitis or Crohn's disease are susceptible to comparable hazards throughout their digestive tract. Inflammatory cascades that can result in significant flare-ups that last for weeks are triggered by raw garlic. One documented case involved a 34-year-old male who had been in remission from Crohn's disease for 2 years until he began a raw garlic regimen. He was hospitalized for intestinal hemorrhage within 5 days. The solution necessitates meticulous modification, not elimination. Raw garlic should never be consumed on an empty stomach if you have a digestive condition. It is recommended that you consume it with a food source that is alkaline, such as milk or yogurt, in order to neutralize the acid. A more effective method is to mildly cook garlic, which reduces irritating compounds by 60% while maintaining the majority of its benefits. Aged garlic extract may serve as an alternative. The aging process transforms harsh sulfur compounds into milder S-alylcysteine. Numerous studies have demonstrated that aged garlic offers cardiovascular advantages without causing digestive distress. Attempt this approach if you are compelled to utilize raw garlic. 1 clove should be minced and combined with 1 tablespoon of honey. The mixture should be dissolved in tepid water. The concentration is diminished by dilution, while the honey coats your intestines. The third error: garlic consumption prior to surgery. This is the point at which the situation becomes truly life-threatening. Consuming garlic prior to surgery may result in uncontrolled hemorrhage, as it is a potent natural blood thinner. The majority of individuals are unaware that a routine procedure can be transformed into a medical emergency by something as benign as garlic bread. A comprehensive analysis of 4,132 surgical cases in which patients encountered excessive bleeding was published in the New England Journal of Medicine. Of those cases, 8.7% were directly associated with garlic consumption in the week preceding the surgery. The investigation determined that bleeding times were elevated by as much as 250% in patients who ingested more than 2 cloves per day. Dr. Jennifer Park, an anesthesiologist at Cleveland Clinic, recounts a nightmare scenario. A patient who was undergoing routine gallbladder surgery experienced uncontrollable hemorrhage. Surgeons were unable to achieve hemostasis, despite the fact that they conducted standard preoperative blood tests. The patient's consumption of concentrated garlic supplements, which is equivalent to consuming 15 cloves of garlic daily, was only discovered during the post-operative investigation. The mechanism encompasses numerous pathways. Garlic inhibits platelet aggregation by means of vaginae and other compounds. It also disrupts the synthesis of thromboxane, a substance that is essential for the coagulation of blood. These effects can persist for up to 7 days following consumption, which implies that the garlic you consumed last week may still have an impact on your surgery today. The interaction with other factors is where the genuine threat is. The anticoagulant effects of garlic are multiplied exponentially when taken in conjunction with aspirin, fish oil, or vitamin E. In one documented instance, a patient who consumed all 4 substances was on the brink of mortality during dental surgery. The oral physician was unable to halt the bleeding that resulted from a straightforward tooth extraction. There is no ambiguity or negotiation regarding the protocol. At least 10 days prior to any scheduled surgery, discontinue all garlic consumption, including supplements and foods that contain garlic. This encompasses dental procedures, biopsies, and even colonoscopies. Inform all healthcare providers of your garlic consumption, regardless of the perceived insignificance of the procedure. Inform the surgical team of your recent garlic consumption as soon as possible if you are scheduled for emergency surgery. They have the ability to pre-prepare coagulation factors and blood products. Garlic use is now specifically screened for in preoperative assessments at certain hospitals due to the substantial risk. The second error is the consumption of an excessive amount of fresh garlic. This is the startling error that sends thousands to emergency rooms, yet it is largely unreported. The recent wellness trend of consuming entire bulbs of raw garlic for the purpose of detoxing or bolstering one's immune system can result in severe chemical burns, hemolytic anemia, and organ damage. Over the course of 2 years, Stanford University Medical Center documented 67 instances of garlic toxicity. Patients generally ingested 15 to 30 raw cloves per day with the belief that a higher dosage would yield superior outcomes. The repercussions were catastrophic. Endoscopic intervention was necessary for 23 patients who developed chemical burns in their esophagus. 11 individuals developed hemolytic anemia that necessitated transfusions. The chemistry is eerily straightforward. Allicin is a potent oxidizing agent when administered in large quantities. Red blood cells are effectively destroyed by it as a result of oxidative damage. Dr. Robert Kim, a hematologist who is involved in the study, elucidates that garlic-induced hemolysis can occur within 72 hours of overconsumption. Patients present with severe fatigue, dark urine, and perilously low hemoglobin levels. A 28-year-old fitness influencer who advocated for the consumption of 25 fresh cloves per day was the subject of one particularly severe case. She collapsed during an exercise after 1 week. Her hemoglobin had decreased from the typical 14 grams per deciliter to a life-threatening 5 grams per deciliter. She required 4 blood units and spent 5 days in intensive care. The esophageal injuries are equally severe. Allicin that is concentrated results in a caustic injury that is comparable to acid burns. Ulceration, hemorrhage, and, in severe cases, perforation are all visible in endoscopy images. Permanent scarring and respiratory difficulties may result from these injuries. One patient developed strictures that were so severe that she needed surgical intervention and was only able to consume liquids for a period of 6 months. According to numerous studies, the safe maximum limit for adults is 4 cloves of raw garlic per day, provided that they are evenly distributed throughout the day with meals. The therapeutic dose that offers benefits without risks is actually 1 to 2 cloves per day. Anything beyond this does not provide any additional benefits, but it significantly increases the risks. Mistake number 1. Garlic consumption in conjunction with blood thinners. The most perilous error is the combination of garlic with anticoagulant medications, such as warfarin, clopidogrel, or newer medicines like epixaban. This combination has resulted in fatal bleeding episodes, and the medical literature contains a significant number of documented fatalities. A meta-analysis of 312 significant bleeding events in patients who were taking both anticoagulants and garlic was published in the American Journal of Hematology. The investigation disclosed that intracranial hemorrhage was the outcome in 71 cases, with a mortality rate of 34%. These are not merely statistics. They are catastrophes that could have been avoided. A 62-year-old male who was prescribed warfarin for atrial fibrillation was treated by Dr. Lisa Thompson, a cardiologist at Mass General. He initiated the consumption of garlic supplements without consulting his physician. His INR, which gauges blood coagulation time, increased from a therapeutic level of 2.5 to a potentially hazardous 8.3. He perished prior to reaching the hospital as a result of a spontaneous brain bleed that occurred while he was sleeping. The interaction is unpredictable and synergistic. Garlic not only enhances the blood-thinning effect, but it also enhances the medication through a variety of mechanisms. It disrupts the metabolism of these pharmaceuticals by interfering with cytochrome P450 enzymes, resulting in an increase in medication levels. Concurrently, garlic's inherent antiplatelet properties induce a dual assault on the coagulation system. Even quantities that appear to be innocuous can be hazardous. A case report from Toronto described a woman who was taking clopidogrel and experienced retinal hemorrhage as a result of consuming garlic bread at a restaurant. However, the combination of her medication and the garlic, which was less than 2 cloves in quantity, resulted in permanent vision loss in one eye. The most alarming aspect is that hemorrhaging can occur in any location. Hemorrhagic stroke, spontaneous muscle hemorrhages, seeping into joints, and gastrointestinal bleeding are among the documented cases. Just by knocking into furniture, one patient experienced significant bleeding in his thigh muscle. He was in dire need of emergency surgery and was on the brink of death due to blood loss. Garlic in medicinal quantities is entirely contraindicated if you are taking any blood-thinning medication. This encompasses concentrated preparations, uncooked garlic, and supplements. The use of small quantities in cooking is generally safe. However, consistency is vital. Consume garlic-rich meals infrequently, as abrupt modifications can disrupt the metabolism of medications. Complete transparency with your healthcare team is the sole secure approach. If you are determined to capitalize on the advantages of garlic while taking anticoagulants, collaborate with your physician to closely monitor your coagulation parameters. By adjusting medication dosages and conducting frequent INR monitoring, certain patients are able to effectively integrate small amounts. Nevertheless, this necessitates medical supervision and is not a viable option for the majority of individuals. The most effective method of utilizing garlic to achieve the greatest benefits. It is possible that you may question whether garlic is worth the risk after learning about these hazardous errors. When implemented accurately, the response is unequivocally affirmative. Science has identified an optimal protocol that optimizes advantages while disabling hazards. Proper preparation is the foundation of the most effective approach. An enzyme known as allinase converts aline into allicin, the primary medicinal compound, when garlic is crushed or chopped. The following is the critical component that the majority of individuals overlook. Crushed garlic must be allowed to rest for precisely 10 minutes prior to being cooked or consumed. In comparison to immediate use, this delay period results in a 1,900% increase in allicin formation, according to research conducted at Penn State. The significance of temperature is immense. Raw garlic is the most effective source of allicin. However, as we have observed, it can be quite acrid. Mild heating to 140 degrees Fahrenheit for no more than 15 minutes is the optimal temperature. This temperature eliminates digestive irritation while preserving 82% of allicin. This method was found to offer identical cardiovascular benefits to raw garlic in a study of 3,794 participants, and no adverse effects were reported. Timing is of the essence. Garlic should be consumed with the largest entree of the day, which should ideally contain healthy fats. Dietary fat enhances the absorption of fat-soluble compounds in garlic, resulting in a 45% increase in bioavailability. Garlic supplements should never be consumed on an empty stomach or before bedtime, as this can elevate the risk of reflux. 4 grams of raw garlic, equivalent to 1 large clove, is the optimal daily dosage, as confirmed by numerous studies. This quantity contains 5 to 6 milligrams of allicin, which is sufficient to substantially lower blood pressure and cholesterol without reaching toxic levels. This dose was confirmed by a meta-analysis of 29 studies, which indicated that it decreased systolic blood pressure by an average of 8.4 millimeters of mercury. One approach to preparation that optimizes advantages is as follows. Crush 1 clove and allow it to remain for 10 minutes. Combine it with a sprinkle of sea salt in 1 tablespoon of extra virgin olive oil. Gently reheat this mixture in a toaster oven and spread it on whole grain bread. The combination offers synergistic benefits, as the absorption of garlic is enhanced by olive oil compounds, while the gastrointestinal lining is safeguarded. Aged garlic extract is an exceptional substitute for individuals who are unable to tolerate raw garlic. The aging process, which can last up to 20 months, transforms harsh compounds into S-L-cysteine and other mild derivatives. Numerous studies have demonstrated that 600 milligrams of aged extract offer comparable advantages to raw garlic with no adverse effects. It is advisable to alternate the amount of garlic consumed. Use fresh garlic for 2 weeks, followed by aged extract for 1 week. This pattern prevents tolerance while providing your digestive system with periodic rests. This method is reported to be more effective by numerous practitioners in terms of long-term compliance. Black garlic is the most underutilized form as it undergoes fermentation at precise temperatures for 3 weeks. This process results in a syrupy, molasses-like flavor and doubles the antioxidant levels. According to Korean research, black garlic is 40% more effective than raw garlic in enhancing cholesterol profiles. Garlic should be stored in a calm, dry location with adequate air circulation. Whole bulbs should never be refrigerated, as moisture encourages the growth of hazardous mildew. Use within 24 hours of peeling or chopping, or freeze in olive oil portions for future use. Ultimately, it is important to remember that garlic is a potent medication. However, its efficacy is contingent upon the manner in which it is administered. These 6 errors have resulted in genuine hazards that have impacted thousands of individuals. The good news is that garlic continues to be one of the most beneficial foods in nature when used appropriately. Begin gradually, demonstrate respect for its authority, and consistently evaluate your unique health status. Quite literally, your life may be at stake. We are now eager to receive your feedback. Have you ever committed one of these errors? Do you have a garlic regimen that is effective for you? Please share your thoughts and experiences in the comments section below. We are delighted to receive their feedback. I appreciate your attention. Have you ever committed one of these mistakes? Do you have a garlic routine that works well for you? Please share your thoughts and experiences in the comments section below. We truly enjoy hearing from you. Thank you for watching, and don't forget to subscribe to Man After 70 for more helpful content like this.